Today we are going to discuss a very interesting topic, and that is endometrial polyp. So what is an endometrial polyp? Polyps are benign overgrowths of the inner lining of the uterus called the endometrium. Typically these are finger-like projections, but they can be flat round projections as well. Though their exact cause remains unknown, factors such as hormonal imbalance, repeated infections or inflammation might be a causative agent for these polyps. So in simple terms, polyps are like the uninvited guest in your house, that is the uterus, who overstay their welcome, and they can cause trouble. Now let's see what all things can happen because of these polyps and what are the symptoms you should look out for. Some women experience abnormal uterine bleeding, irregular menstrual cycles, mid-cycle spotting, or even postmenopausal bleeding. Pain or bleeding during intercourse can also be a sign. However, in most cases, these polyps present with no noticeable symptoms, emphasizing the need for regular checkups. One major effect of these polyps is infertility. The polyp is already occupying a space in your endometrium, that is the inner uterine lining. Hence, it causes problem in successful implantation of the fertilized egg. Research suggests increased fertility outcomes after polyp removal. So if you are facing infertility, then it is essential that you go for preconception evaluation earliest and rule out these endometrial polyps. Now, diagnosing or pinpointing these endometrial polyps requires comprehensive diagnostic techniques. A transvaginal scan is the safest and easiest way to diagnose these polyps. A 3D scan or a saline infusion sonography can help you confirm the diagnosis, confirm its location, and also the number of polyps. Hysteroscopy is also another way of accurately diagnosing the polyp, as we are directly seeing inside the uterus. So diagnosis is mainly by symptoms, a transvaginal ultrasound, or a hysteroscopy. So once you have been diagnosed with a polyp, how do you treat or remove the polyp? If the polyp is very small or you have no presenting symptoms, then we can wait for a few months and see if the polyp resolves on its own. Tiny polyps might go away with simple combined hormonal medication or progesterone therapy. So we can wait for a few months by giving these medicines and see if the polyp has resolved. But if the polyp is of a bigger size, more in number, or causing bigger issues like infertility, then you might need surgical removal by a procedure called operative hysteroscopy. So in this procedure, with the help of a tiny scope which is placed inside the uterus, we can directly visualize the polyp or polyps, and with the help of special instruments like scissors, we can remove these polyps. The polyps which are removed are then sent to the pathology lab for histopathological evaluation. Studies have demonstrated higher pregnancy rates after polyp removal, which is called a polypectomy. Hence, there is a need for early diagnosis and early treatment. Now, there are a few other things that you should keep in mind. These polyps can recur, hence you should go for regular checkups. The hysteroscopy is a painless procedure and you can go home on the same day of the procedure. Hence, there is no need to worry about it. Also, there is no way to prevent this from happening. So don't stress too much. So maintaining a healthy lifestyle, getting regular checkups done, and promptly treating and managing these polyps will help you improve your future fertility prospects.